Okay, Buddhist practice and aging. I'm going to be talking about the role of aging in Buddhist practice and also the Buddhist practices that have been studied and applied in Western medicine. I'm going to be focusing mostly on just teachings from the early Buddhist texts because that's what I'm mostly familiar with. So I can't really talk about aging and its context in Buddhism without talking about the core of Buddhism, what all of the teachings sort of stem from. Um, and the core of it is the Four Noble Truths, which is that there is suffering, there's a cause of suffering, there is a cessation of suffering, and there's a way leading to the cessation of suffering. And that fourth one, the way leading to the cessation of suffering, is called the Eightfold Path. Um, and these are the practices that lead to more peace, according to the teaching of the Buddha. I'm gonna be focusing mostly on right mindfulness and a little bit on right view because that's kind of what's been studied the most in Western medicine. Um, right view. So the term right, I should make this kind of clear. Right is the sense of that it aligns with practices. Kind of like if you're tuning a string on a guitar, and you're trying to get it to the A string to play A. Right view would be kind of like tuning it to that point where it makes that right sound. So it's whatever aligns with a way that leads to more peace. Okay, so there's a vivid definition of aging. And the reason why it's vivid is because the practice was passed along for 500 years through like verses, poetry, and communal chanting. And so there's a lot of very vivid imagery. Here's the definition of aging. So it's like being 80, 90, or 100 years of age, being frail, bent like a roof bracket, crooked, wobbling as they go along, leaning on a stick, ailing, youth gone with broken teeth, with wrinkled skin and blotched limbs, and forgetful. So it's very defined by like biological, right? But it's more of an image of just like, oh, this is what it is. We get old. And as you see in this next line, it says, my friend, didn't it occur to you, an intelligent and mature person, I too am subject to old age. I am not exempt from old age. Let me now do good karma by body, speech, and mind. And I use this text because it kind of covers a recurring theme throughout the text, is that we age and that we are all subject to it, and that we need to find a way to end it. That's the main sort of aspect of aging in Buddhism, is that we age and we need to find a way to go beyond it because it's a part of life. Here is the 5 frequent recollections, which is something that the Buddha encouraged beings to recollect often. One of them is, I am of the nature to age, I have not gone beyond aging. And this one here shows just how, even when you're fully enlightened, when you complete the ultimate goal in Buddhism, that even then the body is still liable to breaking up and to death. And here this verse just kind of sums it up, that the way to end aging is to just stop being reborn. In Buddhist practice, there are 2 kinds of suffering that are kind of emphasized. Is one that we can't really avoid, which is like our body getting hurt, our body aging. That's not really avoidable. But the second one is the emotional aspect of being at peace even in the pain, and that's something that is accomplished, and that's what I'm going to be focusing on for the rest of this presentation, is those tools that are used in order to reduce suffering in this life, and they have been picked up and adapted in Western medicine. The Oxford Dictionary of Sports Science and Medicine defines old age as the final stage in the life course of an individual. Old age is usually associated with declining faculties, both mental and physical, and a reduction in social commitments, including sport participation. The precise onset of old age varies culturally and historically. It is a social construct rather than a biological stage. So here's a Wikipedia definition of mindfulness. It's mindfulness is the practice of purposefully bringing one's attention to the present moment experience without evaluation. It's a skill one develops through meditation or other training. So mindfulness originated from ancient Eastern and Buddhist philosophy and dates back around 2,500 years. The concept of mindfulness has been inspired by many, and John Kabat-Zinn and his colleagues at the University of Massachusetts have been influential in making it popular in the West. So here's a picture of the textbook table of contents. I basically just went down the list of these things and then looked through the research database for mindfulness-based treatments of these conditions. So breast cancer is the second leading cause of death from cancer among women. The median age at the time of diagnosis is 61 years, with 57% of deaths occurring at age 65 or older. There was a 2012 meta-analysis that studied mindfulness-based stress reduction on people with breast cancer. It showed that it had a moderate to large positive effect size on the mental health of breast cancer patients. A study published in 2017 found that mindfulness-based eating intervention may have various health benefits in postmenopausal women who are obese. There was published in 2017 a study that was done on 103 participants aged 65 and older with an anxiety or depressive disorder and subjective neurocognitive difficulties. It found that mindfulness intervention improves clinical outcomes such as excessive worry and depression, and may include some forms of immediate memory performance. A study published in 2015 found that psychological distress in lung cancer patients can be effectively treated with mindfulness-based stress reduction. Okay, so compassion plays a huge role in Buddhist practice. There are many chants. There's countless verses that talk about compassion, and the Buddha's teaching itself is said that out of compassion, the Buddha decided to teach compassion is something that's just central to Buddhist practice. There have been studies on the effects of compassion. There was a study done that found that self-compassion helped with weight-related unwanted internal experiences. A study published in 2018 found preliminary evidence that self-compassion is associated with well-being outcomes in older adults. Loving kindness is another important aspect of Buddhist practice. It's very similar to compassion. Loving kindness is the wish for others to be well, for other beings to be well. There's a very specific meditation that's used to cultivate the feeling of loving kindness. It has several variations, but usually it starts with you sit quietly and you develop a bit of mindfulness. Then you can imagine a being that you feel compassion for very easily, something that you want to take care of, maybe a puppy or something. And then from there you move on to a friend, someone that you care about, and you wish for them to be well. And you start to sort of cultivate this feeling of loving kindness. And then from there you go on to strangers, people that you don't know. and then you just kind of expand it over and over until you encompass all beings everywhere. And the whole point of the thing is to develop this heart of loving kindness, and it brings peace to the mind. There is a study published in 2019 that found that loving kindness meditation slows biological aging. There were a lot more studies that I could have put on this video, but I ran out of time. But I'm hoping that there will be more studies on the effects of meditation and Buddhist practice on other aspects of aging and human life in general.